Did some studies, did come up with a firm diagnosis, continued to have more speech and swallowing, and then swallowing difficulties this spring, to the point where he saw you in June, decided to go ahead and get your G-tube placed.
Yeah.
Who was that placed by? I didn't look. Condren, okay.
And we're going over there afterwards. We don't have an appointment,
But you're having
but
enough
we're going over
issues.
there because we're having issues.
Yeah, that's good, good.
Yeah, but that I got it.
And that's what I hear, that's, you just feel like everything's gone to pot since you got that done. And-
have so much pain.
Oh, okay. Is there any swelling or redness around your G-tube?
Yeah,
Okay,
I didn't trade it this morning.
okay,
She
Sure.
had a CT scan done. They asked for one last Friday,
Yeah.
and we're still waiting for a report on that.
okay.
There's been some miscommunication there. My sister called there yesterday, and so we're going to go over there today and either talk to Nurse Jessie
Yep.
or Dr. Condon,
Perfect.
one of the two. We had some answers.
Yeah, yeah. And so I'll look up at CT of your abdomen, just. But you're not using any artificial nutrition. You're only
Just
pushing
water.
the water. Okay. And your appetite is poor.
Well, I eat better.
It's pretty
Is it
good.
just
I'm hungry.
you're not very hungry? Okay.
So when she eats good.
Okay.
When we had dinner last week.
I have no energy.
And your energy is poor.
Then I would do everything before I got.
Before that.
Now he's doing it.
Okay. Okay. And what do you think? You are having some appropriate reactive mood issues. It sounds like you've had a lot of things happen with your son passing away and this new diagnosis. Tell me about your depression. Are you just feeling sad, overwhelmed? What?
Well,
Overwhelmed? Okay. And are you anxious about life in general, or do you have specific questions and concerns about the ALS?
definitely have concerns over that.
I'm sorry, say that one more time.
I definitely have
Concerns about that. Mm-hmm. What are those concerns?
Everybody have to do everything for me.
Okay, just losing some of that independence, needing to rely more on John, all of that. Have you ever been on an antidepressant before?
Yeah, for a long time.
Let's see, are you on one now?
Uh,
Oh, you're on the Paxil. Now is that, I see, you've actually worked with a psychiatrist?
yeah.
Okay, have you been back to see her since this past Monday? Did she make any adjustments in your
She
medications?
did one thing, I thought I wanted to see you,
Okay,
and she did one on you.
she wanted me, my input?
Yeah,
Okay,
She said she was gonna send it all to you.
she maybe did.
Okay.
Let's see if.
She also, a lot of times, one of her concerns is people seeing her this way.
Ah,
Because, for instance, our little brother Darwin is actually coming today, flying in today with his granddaughter Alex, and she is 10? 9, just going into the 4th grade. And she's not comfortable with her granddaughter seeing her this way. So
Okay.
that's a concern,
that
she
kind of
doesn't
feeds into it.
like to be around people.
Oh.
Well, I try to tell her, says her family is not just people.
No. Family takes you every way, you know?
Yep.
I don't see her note, Laura's note yet. Let me see. Sometimes she may be, if it's not signed, oh, here's in process. Not available for viewing yet. I can have my nurse reach out to her though, because we do want to treat that depression. If that will, inadequately controlled depression will decrease your appetite, make you more fatigued, all of those things as well. Are you sleeping well at night? Okay. And when did you start to notice that your right arm was feeling weaker?
It's been about a month or more.
And what are you noticing is wrong?
I noticed when I eat salad or something, and now I feel it.
It just feels weaker and
Yeah.
your coordination's off? Okay.
I can't do much. I don't know if it's part arthritis or
Mm-hmm.
I believe the disease.
Mm-hmm. Okay. All right. What I'd like to do now is just examine you, so I have kind of that baseline exam, and then we'll break down. Oh, I did want to ask you before I do that, your saliva, how much secretion are you dealing with?
That's what I noticed a lot first when I went to bed at night.
Okay.
Yeah, I get saliva on the pillow.
Okay. Does it bother you much during the day now as well?
You know, sometimes when I eat, maybe once.
Not very often.
Okay. Okay.
But I don't know, you still put that Kleenex on your pillow, you can lays on her side, but I don't know if you're getting any on it or not.
Not much of it.
Okay. And I'll explain that to you. Come on in. Oh, I want to introduce you to Pam.
Figured you would, so I decided to nab a signature.
All right.
Hi,
Oh, did I not sign it in both spots?
I'm her nurse.
Yeah, Pam. This is Pam Michaels, and she's my nurse. She runs the place around here, okay? And she is going to be your number one contact. We're going to get you our newly diagnosis packet, and in there she has her direct number. So, and if we don't get a response from her, then be sure and call the regular number, because occasionally she's on vacation. And we don't want your call not to get addressed by going through the direct line. So, but,
And the rest of you are welcome to call me.
yeah,
What?
The rest of you are welcome to call me as well.
and that may be easier with your speech difficulties. So let's take a moment
Grab that packet
and
now.
Are you gonna use the,
no, that's fine. I'll turn it to you. Okay. So Betty, the very first thing that I do whenever I see a patient, even when they come from Mayo, is just to make sure that I agree with the diagnosis, that all the T's are crossed and everything is in line, and that we're not missing an opportunity to treat something other than ALS. And so looking at your workup, I have most of it. I mean, Dr. Boyle had done quite a bit of it. Then I have part of your Mayo workup, but your EMG study was very consistent with an emerging motor nerve condition. And your symptoms are fitting with the diagnosis of bulbar onset ALS. So bulbar means that this condition starts in your throat, and it's affecting your speech and your swallowing. And the normal natural history of this condition would be that wherever it starts, the neurons around it seem to get affected before the ones that are farther away. It kind of creeps along the spinal cord. So what that means is, if it starts like with your articulation, the swallowing mechanism's fairly close by, Not too far away are some of the breathing muscles, your diaphragm, things like that. It's next things that could happen would be some emerging upper body weakness or neck weakness, things like that. Now when well, let's back up. I won't go there yet. In terms of why you got it, we don't know that. It appears to be most likely a sporadic type of ALS, although you do have one cousin that had ALS. So there are probably there's familial ALS that tends to have a pretty high penetrance of like 50% of people. You either have the good gene or the bad gene, and so there's a higher incidence in the family because you have the possibility of passing on one or the other. But there are some other genes that are probably associated with an increased risk of developing ALS in a perfect situation with other factors. Since you don't have a lot of family members, it's probably more likely that this is sporadic, but you could have maybe a slight genetic tendency since your cousin had it as well. We don't understand why people develop this condition. There are probably multiple causes of the condition, and we're just lumping all those people together. But there's a lot of science that looks into how the cells, the energy system in the cells is affected, the glutamate system, the protein recycling within the cells. And there's been a lot of breakthroughs that have been happening just in the past 5 years in this condition that are really going to pay off with us having more and more treatments. The treatments that I have, there's a lot of things that we can do for you. I don't have a cure for you right at this moment, but that doesn't mean there's not a lot of things that we can do, and things that we can do to improve the quality of your life, your vitality, energy, things like that, okay? So we just have to kind of break it down more according to the various symptoms and then see what we can do to knock off those various symptoms. When you have the onset in your speech and your swallowing, your nutrition is critical. So I'm sorry that you had kind of a rough road with getting that G-tube placed. But you went through that procedure, and it's important that we start using it to optimize your nutrition so that you're not losing weight. I don't want to see any weight loss. And so one thing that I'll have Dr. Condren and Jesse sort through the discomfort and all of that. It's normally going to leak a teeny bit like that at first because your skin is healing. It doesn't look too bad actually. So we'll see what we can do to help make it more comfortable. I'm going to let Dr. Condren and Jesse take care of that. But I'm going to reach out to our nutritionist and get some instructions as to maybe starting to supplement. You can still eat as much as you want, but let's get some more nutrition into you. Because if your weight's going down, your body's not getting the calories it needs. And when that happens, it's going to break down your muscles and you're going to get a lot weaker more quickly. So we can turn that. I've seen people like yourself where, okay, I'm getting weaker, but we can stabilize it once we get that nutrition piece optimized. So nutrition is key. And I'll talk to my nutritionist and she can reach out to you by phone with some instructions. Because of your kidney disease and all those other things, we just want to pick the right type of nutrition for you.
And she's got a ileostomy too.
Yep.
Okay, you do that?
Yep. And then your breathing's a big deal because what happens often is that people have their oxygen levels indeed go down at night. And when that happens, your brain's not healthy, you're not getting a restful night's rest, and it sucks away your energy. So I think it's really important that we repeat that finger probe study and that I hunt down your pulmonary function test results that you had just at Mayo and that we get you in to see Dr. El-Zubaydi. Now, most of our patients use a non-invasive type of a breathing support called a BiPAP or a Trilogy. That you've heard of people that have sleep apnea and they have to wear a mask at night to keep their airway open. Well, we use a slightly different type of mask and machine that pushes the air in and out, and it improves your oxygen levels both at night, and it's been shown to substantially increase your life expectancy, sometimes by more than a year, and your energy and quality of life, because you get a good night's rest, you have more energy, okay? So that's really important, and we'll have to get you in to see Dr. Al-Zubaydi. We, from a medication standpoint, we do have medicines that can dry up your secretions a little bit. There's one medicine I was thinking of trying with you. It's called nortriptyline, and this is an old antidepressant. It would be safe to combine with your Paxil and your Klonopin, and you take it at night. It may get you into a deeper sleep pattern, but it also dries out your mouth even throughout the day. And it sometimes stimulates your appetite a little bit, so it could kill numerous birds with one stone. If it helps your mood, if it helps your secretions, your sleep's not an issue, but if it helps your appetite, those are all really good things, okay? So we'll do that, and that will cut down on your secretions. It's not that you're making more saliva, it's that you don't swallow normally, and your tongue doesn't propel the saliva back normally. So it's very common for people that have weakness there to have too much secretion.
Sometimes, like this morning when I get up, I feel like I got.
Yeah, it's like gurgly. It gets in the way of your breathing, and then you can't get a good cough. And
But my nose runs scratches it.
mm-hmm.
And
That
I
postnasal.
Get it up, but
Uh-huh.
I can't.
You can't get it up. So there's also a device called a cough assist device that helps you kind of cough, and we have people use it twice a day to expand their lungs, because you're breathing, you know, if your breathing muscles are getting weak, then you don't expand your lungs normally, and they're kind of like sponges. And if they don't get expanded, then you can be set up for pneumonia and things like that. Okay? So Dr. Al-Zubaydi will take care of getting you a cough assist device as well. I think your arms and legs are working pretty well. It's not uncommon for you to feel a little like dexterity issues, but your strength overall looks really good. And I think if we could get your discomfort under control, your nutrition under control, your mood under control, and your breathing under control, you got a lot here that you should be living for, okay? Yeah. And we have we'll set you up to talk to someone to look at other communication strategies. You've got that boogie board. Sometimes people will pick up an iPad, and there's some apps that can be put on an iPad that can work really well. And then there's certainly fancier things as well. But it's good to have some of those strategies in place. Now, I have an entire team. We have a multidisciplinary ALS clinic that meets regularly. And normally we have our ALS patients come there because it's kind of one-stop shopping. You get to see myself, my nurse, a physical therapist, an occupational therapist, a speech and language therapist, a nutritionist, a social worker. It's a representative from the ALSA, and you can get signed up so we can give you equipment if you need it. We can help you with your communication.
My daughter signed me up.
With ALSA?
Yeah,
Minnesota ALS?
I'm talking with
Well,
Lindsay.
You're in Iowa. Yeah, you're Iowa.
Yeah,
Okay.
I've been talking with Lindsay, and she's coming up tentatively on the 13th to
Okay.
meet with us.
Well, that's the date I wanted you to come and see us here.
Okay, I can
Because-
tell. She called, and I haven't called her back yet, so maybe we can get another
after,
date.
because then we could give her a list of anything that we need, and then Lindsay can help provide
Okay,
it.
great.
Okay? So my next clinic is on September 13th. And what you do is you come in around 9:30 in the morning over at the hospital. You get registered there. And then you're not in the hospital. It's just that the clinic is in that building. And then you could see the entire team. You're there for several hours, few hours at least. And so bring snacks, because it starts at 10 and it can run into like 2 or 3.
Okay.
And it can be a little overwhelming when you have to meet so many people and you're a fresh diagnosis, but it does allow us to kind of say, what can we do to help Betty and John, and give you all the resources that you need. And other family members can certainly be there to get the information as well. Okay? So I kind of like you to come to that clinic. Let me see, what else was I thinking?
Do we have to register
Oh.
for it or anything like that?
We'll take care of it.
Okay.
The final thing is, I want to talk to you about the medications that are felt to be disease-modifying medications, just so you're aware of those, okay? For about 20 some years, we've had this medicine called Riluzole or Rilutech. Did they talk to you about the meds? Okay. So Riluzole's been around for a long time, and it has been looked at in more than one trial and demonstrated to have a modest effect on the course of the condition. When Riluzole was being studied, one of the challenges we have with ALS studies is that there are many types of ALS. There's bulbar onset ALS, there's limb onset ALS, there are people that there's sporadic, where it only happens to them, it's familial. There's people that go really quickly and pass away over even a year, and then there's people that live with it for 30 years. And so when you're studying it, it's really challenging. And of course, when they were first studying it, the primary endpoint for the trials were, do people live longer? Because that's what people want, right? And so it was powered in that way. And what they found was that when they stuck all those patients together, patients that were on Riluzole lived for about 2 to 3 more months than people that were not on drug. Now that doesn't mean that you just linger there for 2 to 3 more months. The idea is that you're shifting a curve, okay? You're going to get worse at such and such a rate, and with that medicine you may change that slope so it's at a different point. Optimizing your nutrition and the breathing are more powerful. Remember how I said like that getting your breathing device and making that work can increase your life expectancy by over a year, where Riluzole showed that sort of thing. So Riluzole is an option for us, and that medicine is approved by the FDA. I can write you a script if you so desire, and we just have to monitor your liver tests on that medication. Rarely is that a problem, but it has on occasion occurred, and we wouldn't want a medicine to make you sick. So, and occasionally I've had a patient feel nauseated on it or not feel well, but the majority of people feel okay. Probably the main limiting factor for people taking it is whether or not the doctor presents it in a way that sounds positive, because if it's just like, I'm going to live for 2 to 3 more months, well, that doesn't sound like the greatest thing. That's one of the things, and how much it costs you. And it's kind of variable. It's gone generic now. Some people only get it for just a few bucks, and other people have a high copay. And I haven't quite even figured out in Medicare how that all works. But if it's something that you'd like to investigate the out-of-pocket expenses for that, we can sure put that through your pharmacy and they could find that out for you. I do think we want to optimize your saliva and your mood. That's very important. But this is an option for you. You may also have heard on the news lately that there's a new drug that's been approved for ALS. That drug is not quite available yet. It is a drug that they designed the trial very differently. They designed the trial, instead of looking at life expectancy, because it was only a 6-month trial, they looked at this questionnaire, the ALS Functional Rating Score, and said, can we demonstrate that our drug changes the rate of decline? And what they found in that 6-month trial was that people that weren't on their drug got worse by about 7.5 points, where people that were on their drug got worse by about 5 points. So you still progressed, but it changed the slope again, all right? That drug has, it was studied in Japan, recently approved by the FDA, and we're still in the process of getting insurance coverage for it, and then it is an IV drug that needs to be given intravenously on a daily basis for 10 to 14 days a month. So it's kind of a little hassle. It's not a simple pill, it's a hassle, but it's an option that we have. If you would decide that you wanted to be on that, you'd probably need a port, which is a permanent IV access. My thoughts with you particularly right now is that we should get you healed up from this, optimize your nutrition, optimize your breathing, maybe consider the Riluzole, let the dust settle with figuring out how we get that Radicava through insurance, and we can consider it in a little while. Because I don't think you're wiped out. You don't need another procedure. You feel like that procedure made you tank. The last thing I need is another procedure.
Absolutely.
And even the Riluzole, some people just go, I'm not interested. I don't want to take all those meds. And that's, I don't force that medicine since it wasn't a tremendously robust medicine, but it was shown in the bulbar onset patients and in early patients to have a little more robust effect than the later patients. So it's something for you to keep in mind. I'm glad we taped it because that's a lot of information. Questions?
The nutrition part, when Jesse was talking to us about that, he was saying that some of it can be costly and some of it can be not approved. You have to be at 50% or something before it can be covered.
I kind of fudge on that a little bit. We figure out what your optimal nutrition is,
Okay.
and we say that you're going to be eating primarily that nutrition and eating for pleasure.
Good. I like it.
And that way we can, but
Because we like fudge too, it tastes good.
yeah, that's kind of what I do. I may not look good in orange, but, well, this is kind of orange, but we'll try to keep me out of jail with that. Because I think that optimizing your nutrition is critical. It's right now, that's, I think, one of the reasons you're worse. Is just, you're overwhelmed, the mood's affected, you're on a slope, and, all of that just kind of took you down a notch. But there's reason to expect that we can see a little bit of bump up. Okay?
Muscle pain.
Muscle pain. Yeah. It'll be interesting. Maybe that nortriptyline can even help with that because that's actually used for pain. And obviously that's healing. So.
And I have another thing I want to do.
What?
My lips are so red and they peel.
Huh. Maybe you're just doing a little bit more mouth breathing. And so I just keep them, I think you may need more water.
Yeah.
Most of the time, people with bulbar ALS don't drink enough. So we can get you flushing with a greater degree. And, you could take some Ensure or Boost Plus or those sorts of things.
That's could be the diarrhea.
Okay. All of those do?
One.
Have you found any of them? Huh?
It's called Premier.
Premier? That protein powder?
Yeah. No.
No, it's not powder, it's liquid.
Like a boost drink.
Yeah, I don't know.
It has a lot of protein in it.
I don't think protein is, I think there's healthy protein, but we're doing a clinical trial right now that's looking at whether or not our patients with ALS have problems with protein metabolism. And we could the study is closed, but we could certainly just look at your blood work for something like that to make sure that you're not hurting yourself by taking that extra protein.
I don't take it.
And I'd just rather get something a little bit more balanced than that protein, but we'll have to figure out what that is for you, okay?
No, I just had my blood work done
A week ago today,
for Dr. Santos. I haven't heard from him yet.
Santos is really concerned about her kidney function dropping a whole at 27-28%.
Okay,
She just hadn't heard back from that blood test last week yet.
okay,
Because as he says, you know, when you get anything extra like you don't want, like pneumonia or something, the first thing to go is the kidneys and the last thing to come back.
yeah, yeah. So you're kind of frail, there's a lot of things going on.
And I figured the potassium.
Yeah, he put her on potassium last time we, liquid.
Okay. Ah. I don't wanna lose all that. I accidentally made it go away. So. Would you be able to come next, on the 13th?
Yep.
Okay. And you're just stopping by the, Jesse and Condren's office
Yeah, we just
spontaneously,
want to
right?
spontaneously, yes.
Okay.